Question 101. The nurse aide is assigned to a stroke patient with a diagnosis of aphasia. The nurse aide knows A. None of this. B. The resident cannot walk. C. The resident cannot swallow. D. The resident cannot talk. Answer D. Explanation. When a client has suffered a stroke or other head injury, the speech center of the brain can be damaged, resulting in aphasia. Main signs of aphasia include difficulty finding appropriate words when speaking, trouble understanding speech, and difficulty with reading and writing. Question 102. Which of the following is true regarding the use of side rails on a bed? A. Side rail should be raised at night. B. Side rail should not be raised unless stated in the care plan. C. Side rails should be raised on both sides when making an occupied bed. D. Side rails on one side of the bed should be raised at all times. Answer B. Explanation. Bed rails can be a safety risk for some clients who could be injured while trying to get out of the bed. Clients can also become trapped or strangled in bed rails. Using bed rails without permission can be seen as an attempt to restrain the client. Always follow the care plan regarding use of bed rails. Question 103. What can the nurse aide give the resident who has an order for NPO? A. Only clear liquids. B. No food or liquids. C. Small amounts of ice. D. Unlimited fluids. Answer B. Explanation. NPO is a common medical term that means the client cannot eat or drink anything, including water or ice chips. The doctor orders a patient to be NPO for situations such as before surgery or certain lab work. If a client is ill or has a gastrointestinal condition, the doctor may write an order to be NPO until the cause is known. The nurse aide can provide mouth care for a client who is NPO, placing an NPO sign over the client's bed will remind all staff members not to give the client anything to eat or drink. Question 104. Hospice specializes in the care of persons who are A. On Medicaid, B. On Medicare, C. Chronically ill, D. Terminally ill. Answer D. Explanation. Hospice is specialized care for clients who are terminally ill. The care includes the family and caregivers. It does not attempt to cure the client. Hospice is intended to improve the quality of life for everyone involved by taking care of their physical, emotional, and spiritual needs. Question 105. When lifting, the nurse aide should have his feet separated in the standing position to A. Relieve the pressure on his toes, B. To prevent straining his knees, C. Provide a wide base of support, D. Distribute body weight evenly. Answer C. Explanation. When feet are placed apart, upper shoulder about shoulder wide, a comfortable and wide base of support is established. With a wide base, you are less likely to lose your balance. Use the feet to turn, not your back. Do not twist your back or torso while lifting. Question 106. Why should not heat be applied to diabetic residents' feet? A. The feet have more oil glands. B. The feet might be dirty. C. It makes the feet wrinkle. D. Diabetics have decreased sensitivity to heat. Answer D. Explanation. Because diabetics often have neuropathy or nerve damage, they are unable to detect if their feet are injured. Extreme care must be taken to protect the feet from both heat and cold, since the diabetic can't feel temperatures. Diabetics should always wear shorts and shoes to prevent cuts or injuries to the feet. Question 107. A Foley catheter is used A. to drain urine from the bladder, B. for gastric feeding, C. to suction stomach contents, D. as a rectal tube. Answer A. Explanation. A Foley catheter is a sterile tube that is placed into the bladder to drain urine. It is held in place by a balloon that is inflated after being inserted. When a client has an indwelling Foley catheter, the nurse aide should check that the tubing is open so that the urine can flow from the bladder. After each procedure change or when the client returns to the bed or chair after being up, ensure that the tubing is not kinked or closed. The back should be lower than bladder to prevent backflow. Question 108. Which of the following is the proper way to correct an error in charting? A. Draw a single line through it. B. Erase it completely. C. Scribble it out with several lines. D. Use correction fluid. Answer A. Explanation. There are strict guidelines regarding how to correct a charting error. Never erase or cover the error. Draw a single line through the error so the entry can still be seen. Add the date and your initials. Continue with the correct entry. There can be serious consequences for you and your facility if proper protocols for error correction are not followed. Question 109. The plan which begins on the resident's admission and assists when the resident goes home is called A. Discharge plan, B. Nursing care plan, C. Nurse aid flow record, D. Treatment plan. Answer A. Explanation. A good discharge plan allows for continuity of the care that begins on admission. It anticipates possible issues or barriers which the client and their family may encounter, as well as services which will be needed after discharge. All team members can contribute to the plan based on their interactions with the client. Question 110. A resident is NPO for tests. The nurse aide should A. Allow the resident to drink water only, B. Allow the resident to eat ice chips, C. Encourage fluids for hydration, D. Remove the water pitcher and glass from the room. Answer D. Explanation. NPO is a common medical term that means the client cannot eat or drink anything, including water or ice chips. A doctor orders a patient to be NPO for situations such as before surgery or certain lab work. If a client is ill or has a gastrointestinal condition, the doctor may write an order to be NPO until the cause is known. The nurse aide can provide mouth care for a client who is NPO. Placing an NPO sign over the client's bed will remind all staff members not to give the client anything to eat or drink.
Thank you for watching.